Welcome to Vital Signs. I'm your host, Jen Gaudet, and we're here to talk about all things peak human performance, physical, mental, social, emotional health, and well-being. Because what are we here for? Our greatest asset, our health. Today, we're going to be diving into two important topics. One is the evolution of pharmacy and how it's evolving beyond just insurance model, some of the new changes that are happening and what we can start to look for as consumers in the marketplace. And then we're also going to shift gears a little bit and talk about the impact of stress, burnout, and conflict on our health and our lives. You are in for a treat. Our guest, Jeery Fu, is both a pharmacist and leadership coach. He is bringing a unique perspective on how healthcare models are shifting and how patients and professionals can navigate these changes with resilience. Welcome to the show, Jeery.
Hey, Jen, thanks for having me.
You know, one of the things that we wanted to talk about today is the future of pharmacy. We are seeing more and more traditional pharmacies shift towards this more cash pay outside of insurance model. And there's a lot of complexity in the industry. Can you shed a little light on what is this movement? What's happening with this?
Yeah, it's an interesting thing. In the 20 years that I've been a pharmacist, I've never seen anything like it, because there was a point where insurance, ironically, was meant to help people have more accessible healthcare services. But the irony is that now insurance is making it more difficult than ever for people to get the help that they actually need. And so to see this cash-based model where people are saying, hey, you know what, I need this medication no matter whether or not my insurance covers it, it's an interesting inspiration for these patients, and to not need a healthcare system that's technically profiting off their sickness rather than doing their best to keep them healthy.
You know, that's an evolution that we're seeing in multifacets. We're seeing a lot more integrative medicine, holistic health and wellness pop up, and that's outside of the traditional healthcare model, or at least the insurance model. And you and I were talking earlier, and we talked about kind of this Costco style revenue model for pharmacies, and it's gaining traction. Explain how this approach works and how it benefits both patients and pharmacists such as yourself.
Absolutely. Yeah, so the one of the primary examples of this membership-based model is called Good Shepherd out in Memphis, Tennessee. And I'll go and preface that, you know, it works better in richer neighborhoods than less so in neighborhoods. But the idea is that, in a way, this is disrupting the market, because now when your revenue is based off membership, basically in their business model, right, you get to buy drugs at cost instead of whatever markup is normally happening. So the pharmacy doesn't have an incentive to try to upsell anything. They just say, hey, if you give us a certain amount of money each month, we're going to let you, save money on your medications. And they're like, even then, they said, if our model doesn't save you money, don't come here, right? And that's the level of integrity you don't see a lot of. And yeah.
Yeah, you know, it's really interesting because healthcare providers and allied health, pharmacy included, we go into medicine because we want to help people.
Yes.
That is our primary reason for going in. However, over time, it's become more of a keep people sick model, unfortunately, because of the economics of it and because of the way we've been told to practice. There are many cases where we're trying to do what's right, and we know what's right for the patient, but it doesn't fit that actuarial model. How does this cash pay model outside of insurance shift that? Is that something, because we saw that in physical therapy, we saw that in the direct primary care. How is that shifting in pharmaceutical, the pharmacy industry? Are you able to better care for your clients? Are you able to do more education? What does that look like?
Yeah, part of this is really educating the patient and helping them make an informed decision as possible. And the simple gauge to whether or not your advice is actually useful or helpful is, would I tell myself the same thing? And when you tell people, hey, this is the best way to prevent even having to need to go to the doctor to begin with, or to minimize the number of doctor visits, and the system is incentivized to do that. There's a great book called Upstream by Dan Heath that talks about this, where you kind of take out the gamification and incentivization of certain more profitable drugs or medical services. And when you help the patient remember that they're in the driver's seat, despite everything that insurance is steering them to try to do to keep them paying their premiums, now we have an interesting opportunity to really help people become who they were supposed to be at their peak performance.
And so talk to everybody who's sitting there listening to this and they're like, okay, great, this sounds fine and dandy, but what do I need to do? What do I need to look for? How do I find these alternative models, and what do I do with my insurance now?
I think part of this is just, keep your eyes open first, because you want to say who is in their 70s and still robust and active in things, and you have to ask yourself, well, what are they doing? Who are they seeing? Because everybody is going to insist that they are the ones that have your best health in mind. And I'm not here to take away from any truth that comes from those statements, but you want to vet their people, right? You want to vet the quality and their track record, so they make sure that, I have the best chance of being the grandparent and being able to run around with my grandkids, right? What is the vision for yourself is the first thing I would ask patients, right? Because if you don't have a desire to actually eat the most nutritious foods and put in the work to actually keep your body in shape, I think of the book Outlive by Peter Attia, talking about treating your body as a financial investment so that the last 10 years actually reap dividends. Patients need to be coached into having that vision for their whole lifetime, instead of all the short-term gratifications that the world seems to want to have you chase towards. So it starts with the patient.
Yeah. Okay. So you're a pharmacist.
Yes.
And you are in the business of helping cure people through medication. Like that's kind of how that started. And now you're talking about lifestyle changes and eating good food and exercising and moving your body. Things that people have heard on this show before, I might add.
Yeah.
So for the people who are watching at home and they're hearing this, I want to just highlight, folks, Jeery is a pharmacist. He is in the industry, and he says to reap the dividends of your greatest asset, which is your health, you have to start today. So if people are watching, what are the easiest things they can start with today?
Yeah, I think part of this is designing a system to help you with that discipline, because that's been the discussion around willpower is a new one, and I know how much it's helped me when I deliberately design a system. I think of James Clear's Atomic Habits, right? I make my phone as boring as possible after 9:30, so let me make sure I get enough sleep, right? Can I say no to the candy? Can I actually keep nutritious things and make sure that I give myself the best chance of actually eating what I know I'm supposed to eat? That's the first thing. And then, hey, how can I make exercise fun? So these are some of the things that, some simple steps for people to start with, right? To say, hey, let me join a fitness class where people are doing active and creative things. And then once you've kind of design some simple habits that are fun and rewarding around health, that's really the first start, because as I like to say, the more time I spend around medications, the less I hope I ever have to use them or have to recommend that people use them. Actually, I'll be happy to say that.
It's really funny because a lot of times we don't think about these things and we've been sort of conditioned as a society. There's a pill for that. There's a pill for that. There's a pill for that. But every pill that we put in our body, every chemical that we put in, everything we change always has another unintended consequence. So I just want to highlight, Jeery gave us a couple of really good resources. One of them was Atomic Habits. You mentioned 2 other books. What are some really good resources for people who are looking to start these habit changes?
I definitely recommend Atomic Habits by James Clear, Upstream by Dan Heath. Any of the Heath books, really, in a slightly tangential self-improvement sense. Those books are very good about giving you new ideas and seeing the world in a different way and really designing your life. Designing Your Life, that's another one by Bill Burnett and Dave Evans, just realizing, there's a lot of things beyond your locus of control, and at the same time recognizing what your locus of control is, tying into Atomic Habits, tying into meditation and journaling and generating awareness leading to productive action. I'd say I would start with those books just to see what happens.
Fantastic. Well, we are going to have to take a brief break, but you folks at home have had several recommendations for books that you can educate yourself. And if you listened very carefully, it starts with designing the life we want to lead. So I want you to think about, for the next couple of moments, what does that life look like for you? What does that look like specifically with regards to your health? And what is the one thing you're going to commit to today? Because we all know willpower is a little bit of a challenge for us. Maybe it's we're going to rid our pantry of anything that's not healthy for us, and we're going to fill it with very healthy foods. I don't know what that is for you, but make that decision right now, because we have to start with one thing. And if we start with one small habit, we're going to be able to start that positive trajectory. We will be right back after these messages.